Some students on the eastern side of the state say they are outraged after learning BYU-Idaho no longer accepts Medicaid. 6 on your side's McKenna King is live in studio with what that means for any current and future students.
Don, students at BYU-Idaho are required to have medical insurance in the Rexburg area in order to attend the university. To fulfill that requirement, students either have to purchase BYU-I's student health plan or provide proof of insurance through their own provider. But Medicaid is no longer accepted.
I feel like it's more professional to make students aware that they're not going to be accepting these things like long before they're trying to go register for classes.
BYU-Idaho students covered under Medicaid were faced with a recent and rather surprising realization. The university no longer accepts Medicaid as a substitute for their student health plan, and they didn't tell students about it.
I'm actually going to be put on Medicaid here coming 2020 in January.
But Dirk Piper is going to have to purchase another form of insurance, either through a private insurance company or through the university. Those university healthcare plans run $536 per person per semester or $2,130 per family per semester.
It makes absolutely no sense to me. They're in an area that has unusually high poverty.
In fact, according to the latest census data, 41% of Rexburg's population lives below the poverty level.
It's adding a very significant expense onto students who are in poverty, potentially jeopardizing their ability to continue their education.
A local physician speculates the reasoning for the decision might be to help the university maintain a student health center and student health plan, something that may have been hurt by the Affordable Care Act, which allows many people to stay on their parents' insurance longer, as well as Medicaid expansion, which allows more to qualify for Medicaid, something the Student Health Clinic has not accepted for some time.
I think they could foresee that there would be even fewer members if more and more students qualified for Medicaid.
As for reasoning from the school, BYU-I has remained silent on the matter. We reached out to multiple officials at BYU-Idaho and none of them responded for comment. We also reached out to the Church of Jesus Christ headquarters. They said this was a BYU-Idaho matter and to contact the school, but we'll keep you updated if they respond.
So this is BYU-I. What about BYU and Provo?
So BYU and Provo is still accepting Medicaid as a substitute for their health plan. Utah also passed Medicaid expansion this year, so BYU is still accepting it.
All right.